Bonjour à tous. Good morning. Je suis heureux d'être ici.
I'm pleased to be here with Dr. Tam and Dr. New. Minister Leblanc is joining us virtually, and Minister Rodriguez is also with us to answer questions on parliamentary progress.
Team Canada effort. Right from day one, second wave, that's exactly what we'll continue to do. Yesterday, I had my 20th First Ministers meeting with the Premiers to discuss what Canadians need for the weeks and months to come. To begin with, it's vital that frontline workers have access to personal protective equipment. To date, the federal government has shipped almost 190 million pieces of PPE to the provinces and territories. At the same time, we're providing support staff who can make over 14,000 contact tracing calls a day. We're also ramping up our testing at national labs across the country to help the provinces and territories with their surge capacity. In this second wave, just like in the first, our government stands ready to help our partners across the country keep Canadians safe. La lutte contre la COVID-19.
The fight against COVID-19 is a team effort everywhere in Canada. Since day one, we have started with all levels of government to protect you. That is exactly what we are continuing to do during this second wave. Yesterday, we held our 20th First Ministers meeting with provincial and territorial premiers since the beginning of the pandemic, and we discussed what Canadians need for the coming weeks and months. First, it is essential for our frontline workers to have personal protective equipment as much as they need. To date, the federal government has delivered almost 190 million items of PPE to the provinces and territories. At the same time, we are also helping with support staff who can make 14,000 calls per day to help with contact tracing, and labs everywhere in Canada are helping to increase testing capacity. In the second wave, like in the first wave, our government is ready to work with partners to protect Canadians.
COVID-19 isn't just a health crisis, it's an economic one, too. Workers and businesses across the country need support during this tough time. The fact is that the second wave has the potential to hit people really hard. So we're going to keep stepping up to help. Last week, I announced that we were creating the new Canada Emergency Rent Subsidy, which provides direct rent support to tenants. This is in addition to the extension of the wage subsidy and the expansion of the Canada Emergency Business Account. These programs have been and will continue to be a lifeline for small business owners. Just take Amarjeet Shanduk, who owns Taza Express in Brampton. When the pandemic first hit, Amarjeet worried about whether his business would survive. But by using the wage subsidy, the rent support program, and the Canada Emergency Business Account, he was able to keep his employees on the payroll and the lights on. We'll continue to be there for people like Amarjeet and for small businesses right across the country that create good jobs and make our communities stronger. La COVID-19 n'est pas juste une...
COVID-19 is not just a health crisis, it is also an economic crisis. Workers and businesses across the country need support during these difficult times. We know that the second wave can hit very hard, and we're there for you. Last week, I announced that we would be creating a new Canada Emergency Rent Subsidy, which goes directly to tenants. This is in addition to the extension of the wage subsidy and the expansion of the Canada Emergency Business Account. These programs are helping and will continue to help small business owners. These businesses create good jobs, and they are at the heart of our communities.
COVID-19, we need all the tools we can get. With over 4.5 million downloads, the free COVID Alert app is a powerful way to keep yourself and your loved ones safe. If you download the app and come into contact with a person who then tests positive for COVID-19 and also has the app, it will alert you to take action. This helps you to do your part to stop the transmission of this virus. That's why 8 provinces now have the app fully up and running, and we'll continue to work with Alberta and BC to get them to come on board too. If you haven't already, I encourage you to go to the App Store or Google Play and download the app for free. Pour nous aider à lutter contre la...
To help us fight COVID-19, we have a number of tools available to us. With over 4.5 million downloads to date, the free COVID Alert app is very effective to help you to protect yourself and your loved ones. The process is very simple and protects your privacy. If you have come into close contact with a person who then goes on to receive a positive test result, the application will let you know. After you receive the notification, you can then go to a testing center and isolate yourself at home. This app helps stop the spread of the virus and is now fully functional in 8 provinces. Discussions are ongoing with BC and Alberta. So if you haven't already, go to the App Store or Google Play and download the COVID Alert app for free right away.
We must keep taking the fight against COVID-19 seriously. This pandemic is still a very real threat. For several weeks, you've been hearing me, the premiers, and public health officials urging everyone to double down on what we know works to flatten the curve and beat this second wave. Frankly, the numbers are still too high, and that has real consequences. Our frontline workers are at risk, our parents and grandparents in long-term care facilities are at risk, and our loved ones who have pre-existing health conditions are at risk. For businesses, many of which have just gotten back on the road to recovery, this second wave has pushed them to the brink once again. This is very serious, but we have the power to turn things around. So let's keep doing our part for each other and for the people that we love. On doit continuer d'être...
We must continue being serious in our fight against COVID-19. Unfortunately, this pandemic is still a very real threat. For a number of weeks, provincial premiers and territories and public health authorities, as well as myself, have been encouraging everyone to double down and take actions that we know will help us to flatten the curve. The number of cases is still too high, and too many people are still at risk. Our frontline workers, our parents and grandparents living in long-term care homes, and our loved ones with underlying health conditions. For businesses that were finally recovering from the first wave are slowed down again by the second wave. I understand their frustration, but we can still turn things around. So let's continue to do our part to help ourselves and our loved ones. And as a government, we will still be there for you.
This morning, I spoke with Prime Minister Pashinyan of... I told him that Canada will continue to work extremely hard with all our allies to put an end to the violence. I encourage all sides to engage in dialogue to find peaceful resolution to the conflict. This was echoed by Minister Champagne on his trip to Europe, which is wrapping up today. Minister Champagne's trip included a week of meetings with our allies to discuss the global fight against COVID-19. He also had talks about how we can find meaningful ways to support democracy in Belarus. Today, Minister Champagne met with opposition leader Svetlana Tsikhanouskaya to show our support for her and for the people of Belarus. We will continue to work with our international partners to ensure that the people of Belarus make sure their voices are heard. And finally, I want to take a moment to talk to kids out there across Canada. I know that these past 6 months or so have been really difficult for all of you, but I know many of you had birthdays, milestones to celebrate during these past months that were really difficult and a lot less fun than usual. No families, no extended families, no parties, no friends. These are things that kids are struggling with in this time of COVID. This weekend is my dad's birthday, but it's also my son Xavier's 13th birthday. Turning 13 is a big moment where you get to become a teenager and all the responsibilities that come with it. But it's also a time where friends really matter. And not having a party is tough. But as families, as Canadians, and as kids, we need to keep doing our part to keep safe, to protect our grandparents, to make sure that we're slowing the spread of COVID-19. We've asked an awful lot of everyone across the country, especially kids. But I want you to know that we're going to continue asking a lot of you because I know you're capable of it. We're there for you. Make sure you're leaning on each other, but know that we all need to do our part to keep people safe, even when it's our special day. Merci beaucoup tout le monde.
Thank you very much, everyone. I will now give the floor to Minister Leblanc.
Thank you very much, Prime Minister. Comme le Premier ministre.
As the Prime Minister mentioned, yesterday we held the 20th First Ministers meeting since the beginning of the pandemic, when they let us coordinate our actions to better help Canadians. What we expressed to provinces and territories is that which we continue to express, is that the federal government is there to help you.
Provinces and territories is and continues to be. We are here to support you and to support Canadians. We've done so through the $19 billion Safe Restart Agreement, which is helping provinces and territories improve testing capacity and purchase personal protective equipment. We've also set up a $2 billion Safe Return to Class Fund to better support provinces and territories as they adapt learning spaces, improve air ventilation in schools, increase hand sanitation and hygiene, and purchase more personal protective equipment and cleaning supplies. Accessing testing kits, medical equipment and supplies, and personal protective equipment is critical to provinces and territories in their response to the pandemic. We are here to support them and to support Canadians in this regard as well. As recently as Tuesday, shipments for gloves, face shields, and N95 masks were sent to provinces and territories. To be precise, as of today, we have sent to provinces and territories over 12 million N95 masks, over 43 million surgical masks, over 97 million pairs of gloves, over 7 million gowns, over 20 million face shields, over 8 million swabs, and 321 ventilators. Testing remains one of the most important tools we have to flatten the curve. We continue to work with provinces and territories to increase this important testing capacity. We're doing our part by ensuring they have what's needed so they can test Canadians quickly. Nous continuons d'aider les provinces.
We continue to help provinces and territories in their response to COVID-19 through the Safe Restart Agreement, a federal investment of $19 billion, and through the Safe Return to Class Fund, a federal investment of $2 billion, and by purchasing and distributing medical protective equipment and medical testing kits, which are also necessary. Continue to do our part by ensuring that provinces and territories have what they need to increase their extremely important testing capacity. We will continue to work together, as the Prime Minister reiterated last night, to support Canadians across our country. And now,
Bonjour tout le monde.
hello everyone.
In 191,732 cases of COVID-19 in Canada, including 9,699 deaths. Nationally, there are close to over 20,500 active cases across the country. Over the past week, labs across Canada have tested an average of over 77,000 people daily, with 2.4% testing positive. National daily case counts continue to rise, with an average of just over 2,300 new cases being reported daily during the most recent 7 days. Over the past week, there have been, on average, 870 individuals with COVID-19 in Canadian hospitals each day. and 20 deaths reported daily. The resurgence of COVID-19 cases affecting many parts of the country is concerning and something we must keep top of mind to plan safer activities for ourselves and our families during the fall and winter. I encourage everyone to heed the advice of local public health authorities, as their recommendations are based on the local situation. In order to keep COVID-19 activity at a manageable level, particularly in areas experiencing high infection rates, restrictions or limitations may be imposed on higher risk settings or activities. But regardless of the local situation, if you have symptoms, even mild ones, stay home and self-isolate. As fall is upon us, I also want to remind everyone that this is the start of the influenza season. The flu shot provides protection against infection with influenza A and B viruses that are expected to circulate in the Canadian population this fall and winter, while COVID-19 activity continues. Although the flu shot doesn't provide protection against infection with the virus that causes COVID-19, it will help reduce the risk of you getting the flu before, during, or after a possible COVID-19 infection. Having both illnesses close together in time or at the same time could put you at higher risk for severe illness. Getting the flu shot protects you and those around you, providing you protection from infection and serious illness, and reduce the likelihood of you spreading the illness to others. By keeping you and others healthier, the flu shot is also an important prevention measure to help reduce the burden on Canada's healthcare system during this unprecedented time. Our best bet is to keep everyone safer is to layer on all the protections we have available. By following public health practices to reduce the risk of COVID-19 and making sure all our important vaccinations are up to date, we are doing our best to protect ourselves and others. And as an additional measure we can take to break the cycle of infection and help limit the spread of COVID-19, I encourage Canadians to download the COVID Alert app if it is available in your area. Thank you.
Bonjour.
Good day. Before I begin, I would like to also take an opportunity to wish a happy birthday to my daughter Sandrine. In Canada, there have been 191,732 cases of COVID-19 in Canada, including 9,699 deaths. Nationally, there are close to over 20,500 active cases across the country. Over the past week, labs across Canada have tested an average of over 77,000 people daily, with 2.4 testing positive. National daily case counts continue to rise, with an average of just over 2,300 new cases being reported daily during the most recent 7 days. Over the past week, there have been, on average, 870 individuals with COVID-19 in Canadian hospitals each day and 20 deaths reported daily. The resurgence of COVID-19 cases affecting many parts of the country is concerning and something we must keep top of mind to plan safer activities for ourselves and our families during the fall and winter. I encourage everyone to heed the advice of local public health authorities as their recommendations are based on the local situation. In order to keep COVID-19 activity at a manageable level, particularly in areas experiencing high infection rates, restrictions or limitations may be imposed on higher risk settings or activities. But regardless of the local situation, if you have symptoms, even mild ones, stay home and self-isolate. As fall is upon us, I also want to remind everyone that this is the start of the flu season. The flu shot provides protection against infection with influenza A and B viruses that are expected to circulate in the Canadian population this fall and winter, while COVID-19 activity continues. Although the flu shot doesn't provide protection against infection with the virus that causes COVID-19, it will help reduce the risk of you getting the flu before, during, or after a possible COVID-19 infection. Having both illnesses close together in time or at the same time could put you at a higher risk for severe illness. Getting the flu shot protects you and those around you. And it provides you protection from infection and serious illness, reducing the likelihood of you spreading the illness to others. By keeping you and others healthier, the flu shot is also an important prevention measure to help reduce the burden on Canada's healthcare system during this unprecedented time. Our best bet to keep everyone safer is to layer on all of the protections we have available by following public health practices to reduce the risk of COVID-19 and making sure all our important vaccinations are up to date. We are doing our best to protect ourselves and others. And as an additional measure we can take to break the cycle of infection and help limit the spread of COVID-19, I encourage Canadians to download the COVID Alert app if it is available in your area. Thank you.
Thank you, Dr. New. For the question period today, the Prime Minister will answer questions for 20 minutes. Doctors and ministers will remain available afterwards. Le Premier ministre répondra à des questions pour 20 minutes. Les docteurs et ministres seront disponibles par la suite. On va commencer par le téléphone aujourd'hui. Opérateur, c'est à vous.
Thank you. Merci. Première question, Hélène Buzetti.
First question from Hélène Buzetti from Le Devoir. Hello, Mr. Trudeau. You have repeatedly spoken about the need to set up national standards for long-term care centers for seniors, but you have never really specified what exactly you have in mind. Could you give examples? Should be established for certain sectors? Answer. First of all, let me say that the tragedies that we have experienced in our long-term care centers for seniors were terrible this spring, and unfortunately in the second wave, we are at risk of seeing more of this. In a number of provinces, we have seen that there were varying levels of success in managing our seniors' health. And so the first step, something that we would encourage, would be for provinces to look at what other provinces and territories are doing and to draw inspiration to help their neighbors overcome shared challenges. This is a first step that we are now considering together. Some premiers are very interested in what other provinces are doing. Something that has become tremendously clear is that there are agents who are in charge of monitoring infection, and that role is extremely important in long-term care centers. These are some of the conversations we could have. Obviously, our goal is to ensure that all seniors in our country, no matter which region they live in, have the same protection and have a sense of safety in their center, and that their family also feel that same safety. I have full confidence in the authorities in our provinces. But when we are talking about safety and, above all, people's lives, we cannot take any risks, and we all must work together to ensure that our seniors are living well and are protected. And that is exactly what we will do. Follow-up question. Should we understand that when you talk about national standards, that these standards are specifically in line with or based on the pandemic? What about ratios between orderlies and patients? What about food quality? What about cleanliness? Are you really only concerned with the situation given the pandemic? Answer. Well, of course, given the pandemic, our biggest priority is the present moment. We know that there could be a potential additional wave after the holidays, so we are prioritizing protecting people. We have sent $19 billion to provinces for safe restart. But of course, this pandemic has brought to light huge weaknesses that exist in care centers for our seniors across the country. I think that this pandemic has given us an opportunity to better reflect on how we might better protect our seniors in Canada. That is something extremely responsible that we must all do together, and that is a conversation that we are having and will continue to have with provinces and territories.
Next question on the phone.
Thank you. Merci. Next question, Brett Forster, APTN National News. Line open.
Hello, Prime Minister. This lobster conflict out east could play out across the Maritimes in the future as more First Nations plan to fish for a moderate livelihood. The chief there wants you to get involved. Will you do so? And if not, what mandate are you giving the fisheries minister to resolve this conflict?
Our government has been very much involved and will continue to. This is a situation that is extremely disconcerting and of real concern. That's why we're calling for an end to the violence and the harassment that's happening. We need to make sure that our security, have to make sure everyone is protected as well. I understand the concerns and the conflict going on right now, but we need to find a solution. We need to find a path forward that recognizes the inherent and long-standing rights reaffirmed 21 years ago of Indigenous people for modest livelihoods. And we need to make sure that that fits within an important commercial activity in the Maritimes, that is fishing. This is not going to be an easy thing to resolve, but we will work together and we will make sure that we all move forward on a path of reconciliation and greater prosperity for all. Okay.
Answer repeated in French. Of course, this is an extremely worrying situation that we're seeing in the Maritimes with fishers and Indigenous fishers. We are certainly engaged and committed to solving this situation and to put an end to any acts of violence and harassment, and also to ensure that police officers do their job to protect everyone. We will certainly continue to work toward reconciliation with Indigenous peoples, recognizing the rights they hold, which have been established for quite some time regarding the fisheries, and we must find a way together that will work, a way forward that will work for everyone. That is what we plan to do.
Thank you. Merci. Next question, Jean-Paul Tasker, CBC News. Line open.
Good afternoon,
Just
Prime
a second,
Minister.
was there a follow-up for the Indigenous question?
Is Mr. Foster still on the line?
Yes, one moment, please. I'll bring him back.
Here, can you hear me?
Mr. Foster, go ahead.
Hi. Thank you. Yeah. As a follow-up on the topic of Indigenous rights, you know, from Wet'suwet'en territory to Caledonia, and now Nova Scotia, your ministers have been going coast to coast, negotiating these things while also putting out fires, quite literally in some cases. So my question is, why does it always take crises like these to get Canada to the table?
Well, what we have actually seen over these past 5 years is a tremendous amount of partnership and work right across the country where there haven't been crises. Obviously, when there are crises, we need to respond to them, and we will. But we've seen thousands of Indigenous kids starting school years in new schools. We've seen a lifting of well over 90 long-term boil water advisories, many of which have been in place for decades. We've seen significant progress on settling land claims and restoring and fixing historic injustices. We have made significant progress over the past 5 years, but there is always much more to do. Point where it's not just up to the federal government to be making changes along the road to reconciliation. The federal government continues to move forward on protection of languages, protection of child and family services, and ensuring we're keeping Indigenous kids in their communities when they're at risk. But we're also talking about moving forward on Indigenous health legislation, and that's a meeting that's going on right now. So our work will continue, and yes, it will not be easy, and there will be moments of tension, but I think we all need to commit ourselves and recommit ourselves as Canadians to reconciliation. That means all different orders of government, not just the federal government. That also means all Canadians. Understanding the systemic discrimination, the systemic racism that has afflicted far too many Indigenous peoples and visible minorities for far too long, means also looking at how we change those systems and what we change about ourselves and our actions. And it's not going to be an easy conversation, and it's one that is going to have setbacks and challenges. But if we are committed to being the kind of country we like to imagine ourselves to be, always ready to improve, always ready to learn, always ready to be there to defend each other's rights, then we have to keep doing the hard things. The road to reconciliation is difficult, but it is one that we will all walk together.
Answer repeated in French. I think it's important to point out that in the past 5 years, we have made tremendous progress in reconciliation. For example, in health investments, community investments, education investments across the country in Indigenous communities. We've moved forward with protections for Indigenous languages, protections for children who will be able to remain in their communities when they are at risk. Or, for example, other projects like Indigenous health legislation. There are new approaches that are unfortunately very much necessary, as we saw with the case of Joyce Echaquan. This morning I had the privilege to speak with the Grand Chief and a number of Indigenous chiefs to discuss Joyce's situation and the situation of her family, and discuss the work that we all must do to improve the situation. And we have done much as a federal government, but there is more that we must do as Canadians. And this involves all levels of government and even all Canadians. We all must do the difficult work of improving our country, fighting against systemic racism, and creating a country that really does reflect the way we imagine it. A fair, open, generous country when it comes to compassion for others. We do have work to do, but we will do it together.
Merci, opérateur. On va prendre une dernière question au téléphone.
Thank you. Merci. Next question, Jean-Paul Tasker, CBC News. Line open.
Yeah, good afternoon, Prime Minister. I also want to ask you about this good enough. For people like you to tweet about the vandalism and condemn it, he wants the federal government to come to their aid in what is turning out to be a violent standoff. He says the RCMP to this point have been useless. Even this morning, it seems like there's a lot of to ensure the safety of these big mouth fishermen. It seems like what Ottawa's been doing to this point really hasn't done much to keep the peace.
On the contrary, we've been extremely active in trying to resolve this, both behind the scenes and in engaging directly with people. That's why we've called for de-escalation, called for dialogue. We are expecting the RCMP and police services to do their jobs and keep people safe. I think there's been some concern that hasn't been done well and very closely. But we recognize the rights of Indigenous communities to moderate livelihood fishing, and we will ensure that we're moving forward in a way that recognizes these rights that have long existed and need now to be put into place.
Following up.
Yeah, Indigenous Services Minister Mark Miller will meet today with Indigenous leaders to discuss systemic racism and inequality in the country's healthcare system. What do you hope this will meaningfully accomplish? And is the federal government prepared to withhold healthcare funding to the provinces and territories if there isn't some sort of plan there to address the discrimination that so many First Nations, Métis, and Inuit peoples are facing when they're accessing care?
Right across the country, all premiers have condemned racism, and there's still more work to do, obviously. But we are confident that we're going to be able to make significant improvements in the healthcare accessed by Indigenous peoples. But we're not doing it unilaterally. As we did with the question of child and family services, we'll be sitting down in partnership with Indigenous communities, Indigenous leaders, to help design the principles that should underlie better health outcomes and better health services for Indigenous peoples. That's an important first step, and we will continue to work with them in partnership and make sure that we're making these changes. It's too quick to make leap to conclusions about what we might do if it doesn't happen. I am confident that we're going to be able to make significant improvements hand in hand with provinces and territories in improving health care and health outcomes for Indigenous people right across the country. Je pense que c'est important.
It is important to recognize that all provinces and territories have acknowledged the importance of the fight against racism. And so I expect for the situation to improve regarding healthcare for Indigenous peoples. We must also work together with Indigenous leaders and communities to discuss what they want, as we did in previous bills that brought about significant change to protect languages and children. We will move forward to create parameters and principles that will guide us across the country, and I'm confident that we will be able to have better results working together with provinces and territories and Indigenous people across the country.
Vers la salle, première question. First question.
Steve Chase with the Globe and Mail. I wanted to ask you about your conversation with Turkish President Erdogan. Apparently you talked to him today. His government's been very upset with you for suspending military export permits, shipments to Turkey. These include, of course, the target acquisition gear for airstrikes that Armenian Canadians are worried is being used against Armenians in the Nagorno-Karabakh conflict. So not only what did President Erdogan ask of you, but why is Canada still shipping military gear, target acquisition equipment to Turkey, even though there's an arms embargo that you put in place last year?
First of all, I was very pleased to speak with Prime Minister Nikol Pashinyan of Armenia this morning. I am scheduled to speak with President Erdogan of Turkey a little later today, in which we will certainly be discussing the export permits that Canada has suspended because of concerns that they have been used by Azerbaijan in the Nagorno-Karabakh conflict. I will express how important it is for Canada and for our allies around the world that there be a de-escalation of the violence in the region and impress upon Turkey how important it is to encourage people to get back to the table and not continue to participate in the violent conflict ongoing right now.
You talked about the Indigenous health legislation. What makes you believe that this time there will be no jurisdiction conflict with Quebec? Because with C was some challenge. And what makes you believe that this time things will be different? Answer. We often do have discussions on jurisdictions with various provinces. But when it comes to health for First Nations, we have often reiterated that it is the federal government that is responsible. Therefore, we will be working on this issue with Indigenous peoples. Also, we understand the aspects of these situations mean that sometimes resources must flow through the provinces, but I think it is perfectly legitimate to be asking questions about this, particularly following the death of Joyce Echaquan and the tragedy that that community is experiencing. We can have discussions about how to improve health outcomes and health services for Indigenous peoples. That is something that Premier Legault has spoken about. And we will continue to work together because I know that everyone wants to improve the system for all Canadians and particularly for Indigenous peoples.
Next question.
Michael Couture with Global National. Prime Minister, according to the National Council of Canadian Muslims, every mosque in downtown Toronto has faced a credible threat. And several groups are asking you to establish a national plan to dismantle white supremacist and neo-Nazi groups. I wanted to know if and when you will commit to doing that.
We have been extremely concerned with the rise of intolerance, of anti-Semitism and Islamophobia, of racially based violence, of white supremacist groups, of far-right extremism. We have seen increased violence and threats of violence, not just on the internet, but in public and in particularly against religious institutions. We put in place an increased funding a number of years ago for better protections and security systems for vulnerable places of worship, but we know there is much more to do. Our intelligence agencies remain extremely concerned with the safety of Canadians from violent ideologies, and particularly white supremacy and intolerance. We are going to continue to work very hard to keep Canadians safe. Discrimination and hatred has no place in Canada, whether it's online or in person. And we will continue to stand up to protect Canadians.
Thank you. Next question.
Kevin Gallagher, CTV News. Prime Minister, can you be specific about the norms you want to equalize for long-term care facilities across the country? And what do you say to criticisms that this could infringe on provincial jurisdiction?
Well, first of all, the federal government has no jurisdiction over the running of long-term care homes in this country. So we don't have a baggage of experience as to what works best and what doesn't. That's why our proposal around national norms is very much around sharing best practices, first and foremost, between provinces. We've seen varied outcomes in various provinces around our seniors. And I think every Canadian can understand how important it is to make sure that all of our vulnerable senior citizens are properly protected, regardless of which province or territory they happen to live in. I think if this pandemic has shown us anything, it's that there are gaps that have long existed and cracks within which our most vulnerable can slip in our institutions. And to not take the moment of this crisis to reflect on how we can improve outcomes for everyone would be completely irresponsible. We made a commitment to protect Canadians. Every government has a responsibility to protect Canadians. And that's why we look forward to working with provinces across all jurisdictions to look at how we can ensure that every single senior, that every family member thinking about putting their mom and dad into long-term care can be reassured that they'll be well taken care of, that they'll be safe. Obviously, I respect provincial jurisdiction in running those institutions, but we've seen that those institutions haven't done a good enough job in this pandemic particularly, but in a long-standing challenge. This is a moment for us to step up and reassure Canadians that their loved ones, that they themselves, as they advance in age, won't be left aside, won't be made vulnerable. We need to make sure that every Canadian is protected. That's one of the roles of the federal government. And we're happy to work with the provinces to ensure that we can look Canadians in the eye and say, no matter where you live, your loved ones will be well taken care of. Je pense que on a tous appris.
I think that we have all learned during this pandemic that we must do better. We must do better. And this pandemic has pointed out shortcomings in the system that are nothing new and that have existed for some time. And we must be able to look all Canadians in the eye and tell them, we will take care of your moms and dads, of your family, of your loved ones. We will do what is necessary to keep them safe, to make sure they are well cared for. That is a responsibility of all levels of government. to protect Canadians. And of course, the federal government does not have jurisdiction over the management of our long-term care centers. However, we have a responsibility to work together with provinces to make sure that in one province or another, we are protecting our seniors. We can't just say, oh, well, since you're in that jurisdiction, it's acceptable for you to be less well protected or less well cared for. Because we have seen that performance varies from one region to another. Provinces have an opportunity to look to their neighbors to see what works well or less well. The performance in some long-term care centers is much poorer than in others, and it would not be responsible not to look at this closely and to ask, what did they do differently and what can we do better to protect our seniors? And that is why the federal government, or rather that is what the federal government will encourage, because taking care of seniors is all of our responsibility.
About the ambassador from China's comments yesterday. Many people are interpreting them as a threat against Canadians in Hong Kong. The ambassador seemed to say that was open to interpretation. So I want to know, how do you interpret the comments and what is the government doing to respond?
As a government, we've been very, very clear that we will stand up for Canadian interests, and we will stand up loudly and clearly for human rights all around the world, whether it's talking about the situation faced by the Uyghurs, whether it's by talking about the very concerning situation in Hong Kong, whether it's calling out China for its coercive diplomacy. These are things we will continue to do. We will make sure that China knows that not only are we standing up for human rights and calling on a safe return of the two Michaels who've been arbitrarily detained, but we stand with allies around the world, from the United States to Australia to Great Britain to European nations to many nations in every corner of the world who share these concerns. We don't look to escalate, but we will continue to ensure that Canadians know we're standing up for our rights, for our principles, for our values, and mostly, we continue to stand up for Canadians.
Merci, c'est tout le temps que le Premier ministre a pour nous aujourd'hui. On va continuer avec les questions.
Thank you. That is all the time the doctors. Thank you very much. Next question from Émilie Bergeron from QMI. Hello. I have a question perhaps for Doctors Tam and New. Earlier this week, you said that there would be guidelines published. Can you give us an idea of the new guidelines you will be announcing, given that certain provinces have already made their decisions? Answer. Good day, this is Dr. New. Dr. Tam and myself have already shared these new guidelines. They're concerning Halloween. We were saying that Halloween is important for children, but also for adults. When it comes to COVID-19, we have to practice our activities in a safe way, respecting local authorities' advice, because as we know, situations vary from one region to another in the country. There are some principles that Dr. Tam has already mentioned. For example, the ways to distribute candy to children in a safe way. Kids walking in the street from one house to another, as far as I can see, is safe as long as proper hand sanitizing is practiced. And I think that also for adults, this is a good opportunity. Usually, gatherings and celebrations are held indoors, Halloween parties for adults, for example, but this year, it's not a good time to invite friends over or to have a few drinks together. This year, that is not appropriate. At the local level, we have seen guidelines on how to celebrate Halloween more safely. I think that on this subject, we have already said what we had to say on the national level. Thank you.
It was about Halloween and safe practices. I think Dr. Tam and myself, we already commented on Halloween previously. I think Halloween is a very important occasion, I think, in terms of, keeping our society going. I think I mentioned before it's important for children, but I think it's also very important for parents, for adults. I would say that certainly doing Halloween this year in the era of COVID to follow the directions of local public health authorities, because obviously the situation differs from one part in the country to another. I would say that in general, for children going from house to house outdoors, obviously to get candies can be done in a safe manner with good public health measures. Obviously, hopefully, people will use other measures such as hand disinfectants, etc. There's a good way, I think, of being able to both give and receive candies. The one thing we did maybe mention last time that I think maybe also underscores is important to underscore is that I think in certainly the past few years I've seen that it's been a great I think occasion as well for adults to get together, have a Halloween party, dress up. It's a sort of a way to let loose. But I think this year it's probably not the time to have an indoor party with your adult friends and drink and be merry. So I think that would be another point to underscore. But otherwise, I think certainly Halloween could and should go ahead, but obviously following a local guidance.
En suivi, Émilie?
Follow-up question.
J'ai un problème avec mon téléphone.
Yes, I'm sorry I'm having telephone difficulties. As a follow-up question, is Minister LeBlanc still with us? I'm not sure if he is still there, but I do have a question. Mr. Trudeau spoke at length about national standards for long-term care centers. During yesterday's meeting, the 20th First Minister's meeting, was that point raised? And how was your point received by provinces and territories? Answer: thank you for the question. This is Minister LeBlanc. Yes, the Prime Minister did raise that point, and it was also raised by other premiers. As Mr. Trudeau mentioned, we kicked off the conversation by saying that there are practices across the country that have worked. There have been some successes and some challenges that we've seen across the country. So we began the conversation by stating that it would be a good idea for provinces and territories to begin sharing their best practices, pooling their knowledge on things that posed more of a challenge. And proceeding in this way, they can learn from each other. And that suggestion was well received by provincial and territorial premiers. And this, of course, is the type of conversation we will continue to have at our meetings. Everyone agreed on the idea of pooling best practices. And of course, we reiterated the support of the Red Cross in certain jurisdictions, in certain long-term care centers. And we expressed to premiers our willingness to continue with this presence of the Red Cross. And we reiterated the possibility for the federal government to support provinces and territories in emergency situations.
Bonjour, Monsieur Rodriguez.
Louis Blouin from Radio-Canada. Mr. Rodriguez, I would like to hear you speak about the joyous gatherings at Parliament over the past few days. Can you tell us about confidence votes? Can you tell us why you have gotten to where you have gotten over the past few days? Minister Rodriguez. First of all, I would like to talk about committees. Committees are masters of their own destinies, and we don't control what happens in committees. I can tell you that the Conservatives' motion was extremely partisan and also irresponsible. We want to reiterate that we are in favor of looking at all expenses during the pandemic because we think this can be useful for the government and for all Canadians to be transparent about what happened. And anyone can ask any question that they wish. Follow-up question. But when it comes to a confidence vote, where will you look for your support if you decide to have a confidence vote? Minister Rodriguez, Mr. Blouin, you are the only one who is bringing up this possibility. I was referring to an extremely partisan motion tabled by the Conservatives. I have spoken with other parties, and our suggestion is to create a much broader committee to look into all expenditures. And it can look at things that were done well by the government, perhaps other things that were done less well, and this can help us to reflect and to improve.
Monsieur Blouin.
You didn't answer my question. I did answer, Mr. Blouin.
Merci, thank you. Prochaine question, Lina.
Next question from Lina Dib from the Canadian Press. My question is for Mr. Leblanc. I'd like to come back to national standards. Perhaps I haven't fully understood. You were saying that everyone agreed to pool best practices and to learn from their neighbors, but that has nothing to do with national standards. So, are you ready to set aside this possibility of imposing national norms for provinces and territories which manage their long-term care centers? Answer by Minister Leblanc. Well, impose is certainly not a word that we would use. Is the federal government ready to work together? I think that is something we have proved since the beginning of the pandemic. Are we ready to work with provinces and territories to protect our seniors living in these long-term care centers? The answer is, of course, yes. And I have given a number of examples of different regions where we have done exactly that today and yesterday, and probably we will need to continue in this way tomorrow as well. The idea is for provinces to share what they are already doing well and to discuss challenges with infection control, as Mr. Trudeau mentioned. And that was the beginning of a conversation, but of course, we haven't yet had the opportunity to reach a conclusion. The matter of long-term care was part of the observation of how Canada functions during a pandemic, and this is, of course, a conversation that will continue. Follow-up question, but Mr. Leblanc, you started this conversation in the spring, and already in the spring, Mr. Trudeau was saying that it was unacceptable what was happening to seniors in long-term care centers. Will the federal government act? And I am hearing you pull back from the suggestion of national norms. Is that right? Answer. No, Lina, I'm not trying to be unpleasant. We are continuing to assist provinces and territories with the extremely important issue of long-term care for seniors. Mr. Trudeau said that well during the spring. We are still drawing on good thing that we can do to support provinces and territories in such a specific context as this. But the discussion is to be continued. If certain jurisdictions share what worked well for them or what might have been more of a challenge, that is a beginning to a conversation. I'm not pulling back. In fact, we are continuing in order to find the best way to proceed all together to ensure that seniors who live in these long-term care centers are protected as well as possible.
Merci. On va maintenant retourner dans la salle. Prochaine question.
Next question in the room.
Michael Couture from Global National. I just want to follow up on the long-term care facilities and the guidelines. You keep saying that we're going to share best practices. The Prime Minister just said that if we didn't take that action, it would be irresponsible. So do me a favor, paint a picture for me of that call last night. As the second wave threatens to cause even more deaths in long-term care facilities, is there no sense of urgency on that phone call, or is somebody on that phone call holding it up and not wanting to go forward with more broad guidelines for everybody?
So nobody on that phone call would imagine holding up anything that will improve the care that we collectively want to offer Canadians who are resident in these long-term care facilities. So every government and every First Minister on that call obviously wants to do what they can and what we can do collectively together to improve the care that Canadians understandably expect all of us to ensure for those who are resident in these long-term care facilities. So the conversation was constructive. We talked about a whole series of issues. This is obviously an important one. It's no surprise to First Ministers that the Government of Canada shares the concern Canadians have in every corner of the country about what we can do together to ensure the best care possible. It starts with sharing best practices. A number of premiers, both on the call last night, but premiers with whom I had spoken earlier in the day yesterday, the day before, and with whom I will speak later this afternoon, are all anxious to work with us and begin that, continue to be ready to meet the urgent needs that provinces have, as we have since the beginning, as we'll continue to do. But we want to have a longer term conversation about what we can do together to ensure that these Canadians are looked after in the best way possible.
And just as a second question now to the room for Dr. Tam and Dr. New, I don't want to try and have you oppose Dr. Vera Etches, who you've praised, but do you find that it's difficult in terms of messaging? Because the two of you are sitting here saying Halloween in certain places, and yes, listen to your local guidelines. Halloween is a good thing. But then you have local officials saying, not here, don't do Halloween. In terms of the messaging, are you concerned that Canadians will either listen to you or listen to Dr. Etches and just pick and choose who they want to listen to based on, well, one doctor says the thing that I want to hear, the other doctor isn't, so I'm just going to listen to that doctor. Is that something that you've faced or are cognizant of in terms of a difficulty in the messaging around COVID-19?
Well, I think, in fact, we were quite aligned with our national level. There's broad guidance, but that I recognize the fact that in Ottawa is different than in another area of Ontario. So I think that reinforces the message for people that it is not the same epidemic activity across Canada. We're trying to do this balancing act of getting people back to more closer to normality. It's not going to be the same this year, but it does depend on what's going on locally. So we always say, please check in with local health authority. There are different ways of still enjoying Halloween, though, depending on what your local health authority the messages are on influenza activity. So definitely that's your first stop. But we got other suggestions based on guidance. So if you had to sort of not go out, like Dr. Etches says, you know, in Ottawa, trick-or-treating is probably not a good idea. Now, we've got suggestions, which is, of course, lots of other fun things that you can do. You know, virtual costume parties, pumpkin carving outside on your driveway, have a scavenger hunt at home with your family. You know, there are things that might be organized at school, you know, where there's all, you know, structured approaches to getting kids to enjoy themselves. But we have a common goal, which is trying to give kids some fun in the safest way.
Thank you, Dr. Tam. We'll go back to the phone. Operator.
Thank you. Merci. Next question, Alpiraj, HuffPost Canada. Line open.
Thank you. My question is for Minister LeBlanc. The Prime Minister this week, when he was speaking to Manitoba radio station, talked about how some provinces have not hit their agreed-to targets when it comes to testing. I'm going to basically give you a couple of rapid-fire questions. What provinces have not hit their agreed-to targets? He also talked about contact tracers. You talked about capacity, but how many federal employees are actually doing contact tracing, and which provinces are they supporting? And how much of that $19 billion that was agreed to in July has actually gone out the door?
So, Althea, congratulations. You put a whole series of technical questions into one. What I can say is the Government of Canada obviously recognizes the importance of testing in terms of controlling and helping provinces and territories control the spread of COVID-19. Dr. Tam or Dr. New may want to provide some specific answers in terms of how many tests have been achieved. The doctors gave a sort of daily average over the last 7 days. Different jurisdictions at different times, because of a surge in testing demands, have had to catch up. I think what, from our perspective, was very positive is a number of provinces stepped in to help other provinces during these particular surges. So tests done in Ontario might be going to laboratories in my province in New Brunswick or in other provinces. Everybody really wanted to help out to assist these jurisdictions in achieving the maximum number of tests possible. Obviously, the arrival of some of the rapid test instruments that are arriving this week and being shipped to provinces this week and will continue again next week, that will assist directly in improving this capacity. And contact tracing, as Minister Hajdu has said in a number of occasions, contact tracing on our part can be augmented by offering provinces and territories people from Statistics Canada or other trained people that can help provincial and local authorities double down in terms of rapid contact tracing. But perhaps Dr. Tam can answer some of the specific details on how many tests and contact tracers are currently being deployed in different provinces.
I think we track the daily testing numbers, as everybody knows, and it's the details for the provinces will be available on our website. But I do have to reinforce the fact that people are trying to help. So I think, as the minister said, if one jurisdiction has some sort of backlog, we are trying to provide surge from our own federal laboratories. And not just the National Microbiology Lab, but some of the other federal labs that have now been trained by our lab to retool and do some of these tests as well. But that, across jurisdictions, some province will help others if they have the extra capacity as well. So I think that's what I want to emphasize. The rapid test will be another addition to the capacity. But I also just want to stress that, we have published now new guidance on PCR and on antigen testing. People need to try and look at those guidance and align the recommendations for testing with those, because each have their own particular use, and you need to sort of have the right test in the right sort of place and the right people that you need to be testing. So, but we're augmenting capacity every day. And, but I think from the federal perspective, as we allocate things like antigen tests, there will be some holdback for surge capacity so that it can be directed to more of the hotspots.
Thank you. So I'm going to go back. Yeah, to go back to Dominic. And yes, you're right. I'm putting a lot in there, but that's because the answers are not very forthcoming or at all from the government. So I'm sorry to use this opportunity to ask you that question. But if you're basically suggesting, the Prime Minister is basically suggesting that Ottawa has done its part, and actually that's a quote from you, we are doing our part, you seem to be suggesting that the provinces have not held up their end of the bargain. So what provinces have not hit their agreed to targets? And when you say that you have all this capacity, well, how many federal employees are actually being used, and how much of the money that you have pledged to give the provinces has actually gone out the door?
So in terms of the money, obviously of the $19 billion, which was identified for a series of priorities that we agreed to with provinces and territories, a great deal of it was around contact tracing and testing. I think it was over $4.3 billion of the $19 billion. Over 50% of that money has already been transferred to provinces, and the rest will follow an agreed upon schedule. The nice thing is if you sign an agreement with the Government of Canada for an amount of money that will be transferred, you can rely on that transfer. In fact, a receivable from the Government of Canada is actually bankable. You can borrow money on it. So the provinces know on the agreed upon transfers of the rest of the money. But in terms of how many contact tracers in each jurisdiction are operating today, maybe Dr. Tam or Dr. New has that information, or we'd be happy, Althea, to provide details as of today, how many people were working in different jurisdictions doing this contact tracing in support of provincial and territorial partners.
Yes, I don't have the numbers in front of me, but we can follow up for sure.
Thank you. We'll take it back to the room.
For CTV News, this message for House Leader Rodriguez. The Conservatives will be forcing a vote to create an anti-corruption committee. Would you consider this a matter of confidence in the government?
Well, as I said in my previous answer, Conservatives understand forward a very partisan motion, I would say a very irresponsible motion. What we're doing on our side, and we're totally open to having a special committee on pandemic spending. There have been lots of programs put in place by the government to help Canadians. It would be very useful to have a committee to look through all of that. There's things we can learn on the government side. It would be good for MPs, good for the government, good for Canadians. They could ask all the questions they want, but that would be a real committee where real work is done, not something partisan like the Conservatives are proposing.
Would you be opposed to putting an opposition MP at the head of this?
Well, again, I mean,
a different.
But again, this is total pure partisan politics, in my mind, which is totally acceptable in any time, especially during pandemics where our public servants are working really hard to deliver the programs. The government is working to deliver the programs, and they come up with this. I think they could do better, to be honest. They could do better than this. I invite them to join us in this effort to let's create this special committee where we can look at all the pandemic spendings in a responsible way. And they all have my phone number, and if you want to chat about it, I'm free all day.
Thank you. We'll go back to the phone. Opérateur, c'est à vous.
Thank you. Merci. Next question, Greg Quinn, Market News International. Line open.
Hello. I was wondering about the balance I see at the provincial level where some provincial leaders seemed to want to keep restaurants open even as the caseloads were rising. And this came in the fall when many parents were sending their children back to school. What is making sure children have a safe environment to go to?
It's Dr. New. Maybe I can start off, and Dr. Tam can also add to the response. I think it's a false dichotomy. You're talking about sort of public health and quote the economy. I think they're intertwined. It's not a sort of a either or. I think obviously you need a sort of a healthy population to have a healthy economy, and I think the two are intertwined. So I think certainly what we're looking at, and it's certainly we're learning from our experiences collectively, not just here in Canada but around the world, is as we flatten the curve in the spring, how do we in a very how you say deliberate way, based obviously on the evidence and experience and the scientific sort of knowledge that we're gaining, open up in a sort of a deliberate way that also balances sort of the risk to public health with obviously trying to get back to as normal as we can, sort of the way we were before. And I think as we're learning things about asymptomatic transmission, what the role might be of droplets and even tinier droplets, and what some people might call aerosols and so on, that all comes to play. And so I think when you're talking about be it restaurants and schools and so on, they're all a reflection of what's happening in the general community, the general sort of level of transmission. And so I don't think they each sort of exist in their own bubble. And there's certain things that governments can do at both the local level and obviously at higher levels as well in terms of regulating and seeing what needs to be done in a very targeted way, hopefully, to address what's happening locally. But at the end of the day, as we've mentioned previously many times, it does also come down to individual behavior by Canadians in terms of, we keep mentioning it, the physical distancing, the use of face coverings, the good hand washing, hygiene, etc. So I'm not sure, Dr. Tam, if you want to add to that.
Well, I think just to reiterate that to protect the population and supporting the economy, as Dr. New say, is not one or the other. Controlling the virus and the level of transmission is extremely important with respect to society, social and economic factors as well. And so I think the two go hand in hand, because if the virus surges and it becomes unmanageable, and that results in further restrictions, that's not good for the economy. So we've both public health organizations and individuals have to help keep the transmission low, primarily by minimizing the number of contacts, for example, will actually really help prevent this sort of ups and down in impact in the economic sector.
Following up, Greg?
No, that's fine. Thank you very much.
Mia, would you like to go?
Dr. Tam, we have a question about risk and how you decide using sort of risk formulas or some kind of formula when you make an order for people not to do something, or you just strongly advise it. I mean, I'm thinking Halloween in Ottawa, we're not being told you absolutely can't, you're just saying please don't. But when people are coming in from the border, it is an order that they have to stay home. If you have symptoms, we advise you to stay home. How do you make the choice between an order and just a basic advice?
I think partly relates to the jurisdiction of where the regulation pertains to. Of course, for the federal government, the international border is our responsibility. So the Quarantine Act, for example, is set up to in a way to try and minimize risks for Canadians. So as you know, in terms of, there's still restrictions and with both the US and non-US countries, and also in terms of the 14-day mandatory quarantine for incoming travelers is still in place with few exceptions. So now, I think part of it is related to epidemiology. So if you were in different localities, so Toronto, Ottawa, Peel, for example, is a different level of viral transmission risk. So some of the factors that local authorities would decide on whether, asking people to do the right thing is enough, or that further restrictions are required. And so that is more sort of pertaining to the provincial or local jurisdiction that they can or cannot order based on their own regulatory frameworks. But I think in general, I think trying to get everybody on side to do things voluntarily is always the first step. And then if that actually doesn't work, then restrictions may have to be applied, as you've seen in some of the places in Quebec or in Ontario. But I would say that it's based on a number of epidemiologic indicators, based on whether your healthcare system is still managing things and whether the public health system is able to keep up with the testing, contact tracing, and isolation and quarantine. So it's not a singular factor. Some jurisdictions have provided some triggers and levels of which they are basing their advice to their population on as well. So I think always start with, as much as possible, voluntary, but if necessary, local jurisdictions will do what they need to.
We'll take one last question on the phone. Operator.
Thank you. Merci. It is from Marika Walsh, the Globe and Mail. Line open.
Hi, Minister Rodriguez. Thanks for taking my call. I wanted to clarify, are you in support of an opposition MP chairing this special committee that you're now saying the Liberals are in agreement with?
Well, it's up to the committee members to discuss that. What we're open to is definitely to have a special committee on pandemic spending with, regular members and with the capacity to ask all the questions they want. I think it's something extremely positive. I think it's something that allows us to examine all the areas of pandemic spending. There's been many programs that were there from day one to help Canadians, and the members could ask any question they want on one or the other of the programs. And this would definitely benefit all of us, the MPs, the government, the Canes, and could even help the government to improve some of the things we're doing.
And just going back to the questions that both my colleagues at CBC and CTV have already asked you, what should we take from the fact that you're not ruling out turning this into a confidence vote?
Because I'm focusing on trying to create this special committee. As I've mentioned before, I raised this with my counterparts in the other parties. They know that I'm always available. They all have my cell phone. I think this would be something extremely positive for all of us. I would say for all parties, for all parliamentarians, for the governments, and for Canadians. So this is what I'm focusing on. Serious work with a serious committee.
Thank you all. This is what ends today's presser. C'est ce qui met fin à la conférence de presse d'aujourd'hui.
Thank you.